So hello, everyone. Welcome to our panel discussion with Dr. Jutta Treviranus and Alexis Smirnov. We're very excited to be here with them. We're gonna run through a quick introduction on District 3 while we're waiting for others to join. And then I'll introduce our speakers and we'll move right into the discussion. I'm Rosa. I am the events coordinator at District 3 and the back end coordinator of all of our Zoom digital events. I'm very excited to be here with our speakers. So thank you for joining us. We're very excited to be presenting this panel in partnership with Cooperathon. A little bit about District 3 for those who aren't familiar. We're an innovation hub based at Concordia University. We aim to nurture and develop our multidisciplinary teams that work to harness emerging technologies and create businesses that have a global impact. We focus on advancing an open and collaborative ecosystem that enables our entrepreneurs to thrive and succeed. Our programs and services are open to all, and we represent a diversity of cultures, backgrounds, and ideas. We really believe that fostering innovation is a global mindset and is available to everyone. These are some of our metrics that we're very proud of. We are excited to champion a diverse profile of startups and co-founders. 42% of our co-founders are women and 82% of our co-founders are immigrants. We are excited to be operating in 4 districts. We just opened our BioHub district a few weeks ago, which is based at Loyola campus of Concordia University, and we're proud to offer our state-of-the-art dry and wet labs to our biotech and health tech startups. So on to the main event. As we all know, the pandemic has changed the healthcare landscape and affected the adoption of virtual health. In partnership with Cooperathon and the Digital Health Challenge, we're thrilled to welcome Alexis Smirnov, co-founder and CTO of Dialogue, and Dr. Jutta Treviranus, director of the Inclusive Design Research Center at OCAD University in Toronto. Over the last 25 years in the software industry, Alexis has delivered products and services to startups and Fortune 100 companies. His latest role as the co-founder of Dialogue, Canada's leading telemedicine provider, supports millions of Canadians across 25,000 organizations. Dr. Jutta Treviranus has long championed digital inclusion. She's played a leading role in developing accessibility legislation, international standards, and specifications pushing for more inclusive practices. Her work has been attributed as the impetus for corporate adoption of more inclusive practices in large enterprise companies such as Microsoft and Adobe. Moderating our discussion today is our own co-founder and executive director of District 3, Xavier Henri Hervé. Xavier, take it away with the questions.
Hello, everyone. I hope everyone can hear me fine. First, I wanted to say thank you, Rosa, for this great introduction. And thank you for our warriors. I'm going to call you Alexis and Jutta warriors this morning, because you're both in the front line of the digital health and specifically these days in a very difficult and challenging context, which is the COVID pandemic. So thank you again. And our audience today is looking forward to hearing your perspective specifically because of they're entrepreneurs. They're seeking problems to solve. They're wanting unmet needs so that they can create innovation. So they're very much looking forward to hearing your perspective on this world, this fast changing world of digital health. My first question will be for Alexis. Alexis, you're an experienced entrepreneur. You've got a value stack all worked out. You're going to market. You're growing. We'll talk about some changes, some really cool changes that you're bringing soon. But the first thing I'd like you to tell us about is what are you seeing as being the concrete examples of barriers, of externalities which are slowing you down, things that you would like solved?
Well, hi Xavier. Thanks for the question, and thank you for putting up this event, this panel. It's an important work you're doing. Listen, there's a ton of barriers still, and if you take a view that that the virtual care has been prior to COVID a sort of a niche thing, and COVID propelled this modality to mainstream and kind of default choice for a lot of people. That is true, but the systemic barriers to offer healthcare services over this digital modality, over virtual care, they still haven't been addressed. And so when you start looking at specialties and various, if you start drilling into various areas of healthcare, very quickly you find that a lot of things that could be provided virtually aren't, because technologies are still not there. The processes are still oriented around physical interaction between a healthcare provider and a patient. And perhaps the research studies don't show the safety and efficacy of this modality. So at the high level, there's tremendous optimism and lots of proof points. But as you start looking at the specialties, you start to see these sorts of challenges. And so that's really why we're really happy to sponsor the Cooperathon challenge that really encourages people to work at these exact challenges and to bring down these exact barriers to great care over virtual modality.
Thank you. And I note that's a huge field of opportunity, because if I heard you properly, you're talking about how, first and foremost, how the different fields or specialists are organizing themselves around this new digital world. Because it's one thing to make it digital, but it's another one to behave according to digital opportunities and digital mode.
Absolutely. In healthcare, it's not just about writing a piece of software that works. It's really about adopting it. It's really about convincing patients and healthcare providers that this channel is safe and effective. And no one can take that away from the sector. And in fact, that's how it should be. And so you're absolutely right. It's more than just building technology.
Jutta, sorry, am I pronouncing your name properly, Jutta?
Yes, Jutta is great.
Jutta, thanks.
I respond to anything, but Jutta is fine.
Yeah, you and I share the complexity of a non-standard name. You are a warrior for health equity. You want that marginalization doesn't occur. You want there to be a fair and equal access. That's your work and dedication, as I understand it. What do you see as the barriers to that prevent us, or alternatively things that are needed that would accelerate health equity?
Right. So there's quite a few, but if I had to list some of the top ones, digital exclusion is one of the biggest challenges. We have this dilemma that the individuals that actually require the virtual health or healthcare the most are the ones that are often digitally excluded as well. And this is due to a whole range of issues: poverty, lack of reliable internet access because you live in rural or remote communities, lack of access to digital literacy supports, and accessibility barriers due to a disability, or because perhaps English or French are not primary languages. So all of those compound those times of stress when you need healthcare. The other really large challenge is that our systems are generally designed for the average person or the majority. There are no economies of scale for tiny minorities and outliers. And if you are at those margins where you're more likely to require healthcare, or where healthcare is much more critical, then you are often a tiny minority or an outlier. And this design challenge, or the way that we design things or produce things, the way that our markets work, applies not just to the user interface, But also at the moment, quite relevant is that machine learning systems, which rely on big data. From a data perspective, people with disabilities, for example, have quite a number of biases against them beyond the algorithmic bias and the lack of data representation that we often hear now in AI ethics discussions. From a data perspective, they're treated as extraneous outliers because they are different from each other and far from the norm. And if they're not eliminated, their needs or characteristics are overwhelmed by the majority data, even in recognition systems that are intended to overcome these barriers. And so the strategies that detect the bias or treat them or are intended to address them don't work in those areas. So we have these vicious cycles of exclusion that occur within the field.
Okay, yeah, complex. You're telling us first that there's a bunch of elements in the system that range from digital barriers to poverty to economic barriers, which are inherent to a system globally, and then you're adding to the fact that the dynamics, the design is based on in startup world we call it an ideal customer profile, and you wish that they would be designing according to different populations, to different groups, different needs, and you're wondering if the will on one hand is there, even the awareness is there, but also if the economics would enable this, or what would be required from the system to make this possible, right?
Yeah, and actually, I think there's quite a number of myths within the market economies that are there at the moment. One of them is that, I mean, it's based upon basic market or economic arguments, that the Pareto principle, or the Richard Koch's Pareto rule, where deal with the difficult 20% last, or focus on the majority, the 80%. They require the least effort. That's the way to make quick wins, etc. But what we've actually found is that if you focus on the entire range right from the beginning, then you're more capable of creating a system that will cost less in the long run and will be more dynamically resilient. It won't be as brittle. It will ensure that those unexpected things like this COVID pandemic you'll be able to adapt to that with the system that you've created. So you're right, it requires a rethinking, a reimagining of how to design, how to create a market, how to advertise, how to search for truth and evidence within our research.
That leads as well to the next question for both of you, is that what we're seeing in this time of pandemic is our governments are I'm very proud to be in a country where our government is actually adding a lot of money and efforts to this emergency. We've got some countries in the world, one for me who was an example of reactiveness, flexibility is Taiwan, in a person you may have heard of, Audrey Tang. But there is the government's responsibilities. They've done a lot. Could they be doing more in your mind? What should they be focusing on? What are the immediate things they need to solve, do better at? And maybe Jutta, you can continue on that thought.
Or Alexis, do you want to respond? I definitely have a response, but go ahead. You looked like you were about to speak.
Well,
Alexis,
Xavier, you're the boss.
Go ahead, please.
Okay. Well, listen, I agree with you. Canada have done a good job in encouraging people to stand up and really kind of help the situation. And Dialogue is, in fact, one of the companies that participated in the first wave and in creating systems based on some participation from the government through Scale AI initiative. We built a Chloe for COVID chatbot that provided accurate government authored information to Canadians across all provinces. But you're absolutely right to say that there's more to be done. Specifically in virtual care, what I see is a patchwork of regulations, provincial regulations that's authorize virtual care for public healthcare system, but in a kind of a partial way, in an unfinished way, and there's certainly no central technology strategy to support the shift from physical first to virtual first to digital first. And I think that's where a government needs to play a bigger role, is to really foster and drive that transition, because let's face it, the entire world is going from physical first to digital first. And so governments with public healthcare systems need to participate in that and drive that wave.
Yeah, and I imagine that provincial dynamic of health in our country is a challenge, as you were saying, because in regulated environments, in government animated environments, I come from the aviation world. Our authorities, as we call them, were national. In the U.S., the Food and Drug Administration is a national infrastructure. So if you're being faced with provincial structures, Canada is already a challenge because of its geography, and now if you're going to bring that into X amount of provinces, you're meaning different regulations. That's a very hard thing for a company to deal with.
Yeah, absolutely. And I'm not talking just about Dialogue. Like, certainly we are impacted, because in principle, you can imagine how a doctor in Toronto can serve somebody who's in Saskatchewan, right? Because it's all remote and virtual. But in reality, there are various constraints on the location, present location of the patient, and a license that a physician or a nurse has. So all that system was created not for virtual world. It was created really for physical world, and so we need to really adapt that system to a new reality, and hopefully governments around the country are recognizing that that's an urgent necessity.
Thanks. And you, Jutta, your perspective on the governments in telehealth.
Yeah, I think the governments are also worried about the majority, and creating a consistent message, creating consistent services. But of course, from the user perspective, from the patient perspective, there are very, very diverse needs. So, and whether it's provincially or the health services that are under federal jurisdiction, there's a lot of gaps still. So one example I'll give: in Ontario, if you require alternative access systems because of a disability, you generally rely on assistive devices program to fund your equipment. Well, that doesn't get renewed. It only gets renewed every 5 years. So the majority of the individuals that require alternative access systems, who are often also have compounding complex health issues, are probably not going to have the necessary devices or that will allow them to participate in any virtual health interaction. In fact, the majority of individuals that require alternative access systems cannot use the contact tracing app because they have legacy equipment that won't work. So there's the whole path that we need to think of. And of course, there are people living in areas where there is not yet, as yet reliable internet access or even cell phone access. So we need to there's both ends of the delivery or the interaction that we need to worry about.
Yeah, for sure. And I think you're bringing up an important theme. It seems to be a recurring theme before we move to even another dimension, which is international dimension. You're bringing up the thematic that design thinking, or a design approach, a global design approach, integrating all the problems from day one in one cohesive way, and involving all the actors as well, to bring back Alexis' point on the different levels of governments. There has to be someone who takes that lead, someone in our government who takes that lead to make it happen. They have to be aware of it, and then they have to make it happen.
Well, either someone in the government or someone who understands that the government will not be ultimately solving these design problems, and needs to engage the private sector to really be a credible partner there.
Yeah, and this is where our entrepreneurs that are listening to us today can start building solutions to make all that cohesive.
Yeah, and I'd like to just add a note to the design thinking. In design thinking, you have that squiggle, which through a competitive process arrives at a winning solution. And we find that that actually isn't the greatest way to approach this. What we have instead is what we call a virtuous tornado, where you iteratively cycle out to include more and more individuals. There's no one winning, one-size-fits-all solution to any of these things. What you need to do is you need to create a system that can adapt and expand to encompass the whole diversity of requirements and the complexity of needs that are out there.
Yeah, well, that sounds very much what we try to bring to entrepreneurs, is start with a dot in the middle and then start to grow in a circle around the different audiences and expand your reach. On the international level,
I would say start at the edge, because if you address the needs at the edge, then they will encompass the needs within the middle. So, sorry,
okay.
I didn't mean to interrupt. But
no, thank you. Yeah, no, I that's a good point. You're saying start at the edge and think globally, implicitly. That way, you'll get the middle.
Yeah, because that's where the weak signals are. And that's where you also find the greatest innovation. If you want to be a company that distinguishes itself from other companies, everybody's going to start with the largest customer base. But in order to do something that is alternative and innovative, you're not going to find those ideas with people that are complacent and for whom the current systems work. You're going to find that by talking to the people who have difficulty or can't use your current systems.
Yeah, I'll just echo what Jutta is saying by just reminding how great startups are made. You want to build an MVP, you want to build a minimal viable product, you want to select a niche, and then refine your product in the niche and expand. And you want that niche to be kind of free from the biggest competitors, so that you can actually have some time to refine it. So it actually fits well, this idea of thinking about various kind of niches or minorities, or to mirror it into healthcare space, various health specific health issues or specializations. All these things are actually quite useful as you think about a project to build.
Okay, really good point.
Or if perhaps you're attempting to create a platform that is going to be more expansive, then you create a software architecture that is much more adaptable by virtue of not a single niche, perhaps. I mean, by creating a foundation that can stretch to a whole variety of things. If right from the beginning you create that foundational architecture to be expansive, then you're going to survive beyond. I mean, there are, of course, companies that all they care about is being bought up by a large enterprise company at some point. But if you plan to create a dynamically resilient company that will live longer and grow, then create a foundational architecture that stretches to the edges.
Okay, I'm going to throw in a question from the audience as you're talking about. What are the commonalities of care services that are particularly well suited for your telehealth environment, for this virtual environment?
I can take a stab. So the macro stat is if you look at interactions between patients and healthcare professionals, 70% of all interactions can be done virtually. We're nowhere near that number right now. So that's kind of a maximum, a ceiling, if you don't consider new technologies like wearables and consumer devices and sensors, etc. So I think there's just so much opportunity in adopting virtual care in various healthcare specialties as it is across the board, that it's a question of what you know the best, which area you know the best. There's probably opportunities there. If you look at the provision of care, there are obvious kind of areas of healthcare where it will not work, like surgery or whatever, right? But even then, we're talking about remote robotic surgery, right? But let's take that aside. I think anywhere that a physical contact is absolutely required to provision of care, then that element is kind of out of balance. But even in those cases, think creatively. Think what happens prior to that physical contact and what happens after that physical contact. Provision of care is rarely a transactional 5-minute type of interaction. There's probably things going on before and after that intervention. So think about those things as well, and they're actually quite amenable to virtual modality as well.
Okay, thank you. I'm going to switch back to the government levels. We spoke about provincial, national. The health sector, since it's regulated, is also must be grouped internationally. How do you see the world map? Do you see opportunities? You just explained about opportunities within the different specialties, and your advice was focus on what you know more about. How about this world of international? Is there other opportunities or more opportunities in Europe than would be in Asia or in the USA? Do they have different adoption vectors?
Yeah. Well, so the wave of going from physical first to digital first is a global wave. It's a question of time. The entire globe is going to be to be transformed. There's no doubt about that. But we're living in a world where healthcare systems are regulated country by country. So even if you have an amazing idea, an amazing execution, and very, very useful product, chances are you won't be able to deploy it globally. And it's too bad because, obviously digital products and, internet-based products can be deployed globally, and, TikTok can cover the globe, in weeks' time, but we don't see that in healthcare because it's regulated country by country. So think about the the process of expansion in a more systematic way. Think about the countries that are that have similar healthcare systems to the one that where you're starting from. So if you're starting from Canada, look at countries with similar socialized medicine type of systems. Perhaps that's going to give you a path of expansion better than just trying to do a global launch. So Dialogue has an office in Germany. We've been fortunate to find a niche in Germany that is in fact not exactly the same thing that we're doing in Canada, really because of the regulation on the ground and different opportunities in Germany. But it is certainly possible, but it's not automatic as in consumer software.
Sure. And Jutta, I know this wasn't a question for you, but you've worked with the World Health Organization. You told me about this a little earlier. Do you see them, do you align with Alexis, or would you say go see the World Health Organization because they can give you global market access or global problems, global opportunities?
Well, actually neither direction. I think that I have two comments to add to Alexis' comments. I generally agree. The first comment is that quite frequently it's the countries where there isn't an entrenched infrastructure that are able to innovate much more quickly, because there's nothing to deconstruct in order to reconstruct a new novel approach to something. And so we actually find that there are some really interesting things happening in a bottom-up way in countries where you would imagine that there would be fairly huge barriers. There isn't anything to unlearn. There isn't something that the assumptions and presumptions that you have about who provides the healthcare, how it's provided, etc. The other thing I would say is that in this area, I agree with Alexis, there isn't sort of a global approach, because each country has its own conventions, and you need to think about more than just the provision of care. It's how are people paying for this? How are they getting to it? How are they accessing it? The regulations, not just for the provider, but also for the patient and their family. And so it's, again, you need to take a systemic approach. And in order to do that, you need to involve individuals that are within the countries. To assume that you can create something that will work anywhere is quite naive. It's best to engage the individuals, especially the individuals that are going to have the greatest difficulty with your system, in not just creating the system in the first place, but in bringing it to other contexts and situations.
Yeah, we had a startup at D3 Ubenoa, and they were dealing with the problems of asphyxiation, a baby infant, a very young infant asphyxiation, and they have a very cool solution, very pragmatic, very proven. It was easier for them to launch this in Africa than it was a long shot to launch it in Canada or the US, because of the establishments and the regulatory frameworks made it very difficult. So yeah, I relate, and I've seen it. If we go back to the core element of innovation, which is knowledge, because it's with knowledge that we make solutions, and universities is where knowledge is. That's their mission, to generate knowledge and to distribute and get it to people. Do you see universities having to play a different role in this digital equity context? What could they do to make it a faster acceleration, or what problems should they be helped to solve?
Yes, this is one of my big bugbears, because I think that university and the university processes, just our systems of research, are in large part to blame for the what's happening within artificial intelligence, what's happening with respect to the exclusion of people that are outliers or the margins. I mean, our favored research practices are diversity and complexity reductive. And I think what we need to do is rethink how we do research so that it's more supportive of the diversity that happens to be there, because the way that we are conducting research and rewarding research and valorizing particular forms of evidence mean dependent upon statistical power, statistical significance, which then it's a cycle. So if you don't have those specific requirements, if you haven't done traditional RCT, you can't get published in high impact journals. You don't get impact factors that will give you tenure. You don't get funding. And so as a result, you have a paucity of knowledge and research in outlying and minority fields. And that's where many of these unexpected black swans, like the pandemic, came from. And that is where the greatest vulnerabilities are. And so I think there needs to be a fundamental rethinking and realignment or recalibration of how we do research, what research we favor, what assumptions we make when we're doing research. And I think to some extent, the more innovative entrepreneurial companies that are working on bottom-up edge type solutions are the ones that will assist the academic institution or the academy in making that transformation.
So there is a possible partnership between these those that are at the edge and those that are executing research.
Oh, definitely, yes. Those, I mean, the one of the most promising and innovation producing and risk identifying strategies that we have is CoDesign, where you actually bring the individuals that have the greatest difficulty or can't use your current systems right into the design process from the problem framing onward, because they're the best stress testers. They're the first to be vulnerable to the flaws in your system, the cracks. And they're also the ones that will come up with novel ways of doing things. So the best strategy is to find people that for whom the current market doesn't work, the current market alternatives don't work, and get them to help you to frame the problem, figure out what are the approaches that might work, and continuously refine. That's certainly a strategy that a number of the more thoughtful companies have taken up with great success.
I have thank you, and it is a design approach that involves a lot of parties. And it relates to one of the questions I'm seeing on the screen now, which is to who do you advise as a, and which Alexis as a startup founder, who do you advise them to reach out to for official partners? So Jutta was telling us about universities. Who else are these official partners when these people have MVPs and they start running into either regulatory frictions or adoption frictions? Who's the best people to help them? Who should they be talking to?
I may be biased, so take my answer, as such. But from my perspective, the other commercial providers may be a better choice as a partner, as opposed to perhaps a traditional way of going to a hospital and doing a pilot at the hospital, or doing something together with a government. The reason for that is I don't want to criticize hospitals and governments, but there are systemic constraints on how fast they can move and how quickly you're going to get the feedback on your solution that potentially could work or not work. And so if you align yourself to other commercial providers, perhaps you're going to reach a smaller audience because you're going to be constrained to a customer base of that commercial provider, but you will probably going to get traction faster. Like we certainly are interested in partnership opportunities because we consider Dialogue to be a platform of programs that we offer to our members. We started with primary care, expanded to mental health, and recently to employee assistance program. That is, there's majority of assistance incidents are mental health related. So you can see a pattern here. And so it's not the end for us. Of course, we're going to be expanding there further. So that would be my advice.
Okay, I'm going to jump into the environment of data and digital means. We see that when we talk data in health, it's inherently very personal and sensitive data. Data privacy is a raising issue everywhere in every subject, but I would think more than ever in data in health. Are you seeing resolutions to data privacy concerns? Or are these things a domain of opportunities where entrepreneurs can tackle great big problems?
Do you want me to go first? I can. I think one of the biggest issues is what I call this data impasse. The individuals that most need knowledge growth in the area, or that need the insights that come from data, are also the most vulnerable to data abuse and misuse. So the individuals that we work with often, because their needs are very unique, so they need to ask for exceptions or they need to ask for special services. And in the process of doing that, they're bartering their privacy for the essential services that they need. And quite often, because of the way that privacy legislation works, especially in virtual health, because it crosses that border between things that are classed as health related and things that are classed as digitally related or that are outside of the health domain. The other thing is that all of the privacy, I mean, even in Europe where we have the GDPR and where here in Canada, the privacy protections that we have created or that have been regulated don't work for you if you're highly unique. If you're the only person, say, in your neighborhood that's ordering a colostomy bag, then you are going to be re-identified. So any bad actor can determine that, yes, you're in a time of stress, you're anxious, you probably have a disability, you may be aging, and so that's the person that is targeted with disinformation, with fraudulent sales claims, and also possibly identity theft or other financial related things. So the issue is that the people that are most vulnerable to data abuse and misuse are also the individuals for whom the privacy protections don't work. So we need to go beyond this notion of protecting privacy or locking up the data in some way, which is the primary way that we're addressing the issue of privacy right now. We're restricting the good actors and not dealing with what the bad actors are doing. We need to assume breaches and then figure out how we can protect people from data abuse and misuse by the bad actors.
Yeah, I'd echo what Jutta is saying, and really, if you look at it, we haven't solved it as a technologist, as a society. We don't have a solution for privacy, and Jutta highlights actually the edge cases, with failure cases where it doesn't work. So I view this as a super important research area. And there's a lot of people who work on differential privacy and other related technologies, but really, I think we need more more time from research community and really a kind of recognition that we haven't nailed it yet. And so to suggest that entrepreneurs or software engineers just don't care about privacy, that's why all these edge cases exist, that is not true. They exist because we simply don't have yet the full technology to solve these issues, and it remains a research problem. And yes, of course, there are bad actors who actually don't care about privacy, build systems that don't care about privacy or exploit things. But by and large, people do want to preserve private information, keep things private, and edge cases still come back, and it's still unsolved issue.
There's two potential approaches that I mean, in addition to things like differential privacy, but each of those, all of the ones that exist at the moment, don't actually go right out to that vulnerable edge. Some of there's ways to restrict data overreach. So the terms of service agreements, which are at the use of digital technologies, where no one's read any of those terms of service. It's a binary choice: either agree and get the service, or disagree and you don't get the service. So we need to get rid of that convention and make it more of a relevant negotiation between the data producer, the patient or the person, and the company. One of the things we've been looking at is a privacy preference, a portable privacy preference standard, where you both educate the individual regarding the risk of giving up a certain piece of data and what are the opportunities. They declare who they trust with what data for what purpose, under what conditions. The service that wishes to use the data then needs to declare in an auditable and transparent way what data is essential for the service, and there is then a negotiated process. Those, rather than a constant pop-up window to say, do you agree to this, etc., there is some portability in terms of what you've stated, you trust or you don't trust. So there are mechanisms to do this. The other area that's quite promising is this notion of cooperative data trusts. And there are examples of this in Europe, such as midata.coop, midata.coop, or others, where what's happening is the individuals that are not covered in standard research or in markets are banding together and creating a self-governed data trust, and then simply releasing not the data itself, but the responses to the questions that are put to the data trust.
Yeah, there is a lot of different efforts in terms of digital data management. I was very impressed last fall with the French government's approach to it. They basically decided that data was a public asset, and united that all into one health database available to startups, enterprises, including to the international world. I think they were going international by step, but they were having a very, very, very different approach to personal data and its management. Have you guys heard of their progress?
I haven't been tracking closely, but I am also impressed with what French government did. It's certainly a promising direction to not only centralize but also to regulate and manage access to those resources. This is where Canadian governments, the provincial governments can learn a great deal. we do have these repositories of health information in Canada, but access to them is convoluted at best. It's not an effective system to build some value added services on top of that data set.
Many challenges, yeah, and I think there's not many models, but some countries are frameworks, but again, our government have to look forward to them. We have a few minutes left. I'd like to ask your questions about your vision for the future. Maybe starting with Alexis and Jutta, you'll conclude. In Alexis, what's your feeling about where this telehealth world will be 5 years from now? What's your dream? What's the dream that you're pushing to turn into a reality?
Well, listen, it's very clear that we will transition to digital first healthcare. No one remembers the last time they were at the curb at the intersection hailing a cab because they can do it on the phone. Like that's second nature for us. No one remembers going to visit a travel agent somewhere to book up a hotel room. Like that is just not how we think. And then there is healthcare, where that is how we think. So I think over time that thinking, those habits will change, and it will be a new default for how people get great care. And as that happens, I think I'm optimistic that we will find solutions that work with minorities, that work with special needs or specialized medical conditions. It's also like, let's not forget that the phones that transformed our humanity exist only like a few years really in this current form. So it's a very new technology, and new technologies are coming up. So in 5 years, there's probably going to be something else than just a phone in your hand. So those technologies will help that transition. So from my perspective, what I see is a broader range of healthcare services available to a broader range of people over this modality. As a result, I see a better quality healthcare delivered to more people.
Okay, thank you. And Jutta, what's your vision for the future when it comes to this, to what we were talking about earlier, which is equity and social fairness in terms of addressing the needs of all these peripheral on the edge communities or special needs communities? How do you see this changing over the next few years? What are we about to overcome and see released here?
Yeah, so my optimistic side thinks that this pandemic and the necessary move to virtual health offers a disruptive opportunity to address a number of the systemic barriers that are there. I think so in terms of my vision, I would see that a much greater democratization of the healthcare field with one of the things that we know will happen is we live in a very complex adaptive system, and there are going to be more of these disruptive moments and disruptive crises. And so I think the only way to adequately address them and not ignore those weak signals, those early warning signs of things to come, is to actually design our healthcare system so that that we encompass the needs of the edges rather than ignoring them as the difficult group that we should not address, because that will compel us to create a healthcare system that will work for us when we all find ourselves vulnerable. I mean, none of us are safe unless all of us are safe. And what we've been doing is we've only been looking at the majority because that's where we feel the market is. And that is unfortunately reinforced by our research systems and even our governments, which are anxious to have greater market dominance globally. And so we are ignoring the place where there is the greatest innovation and the place where we are going to be able to better predict what's to come and prepare for what's to come. So my vision, optimistic vision for the future is that we'll learn our lesson from this current crisis and address the needs of the most vulnerable first. And that will prepare us, and that will also help us to build an infrastructure and a system that works for all of us when these things come about.
Yeah, well, you've given us a lot of hope, both of you today, and mostly you've given us a lot of problems for our entrepreneurs to solve. It sounds like both at the international, at the regulatory, at the commercial level, at the design thinking, at the user, at the universities, there's tons of opportunities. So thank you very much. It was great listening to you from my perspective, and I trust that our participants loved it as well. So thanks again. And you've given me lots of hope for improvement in the system. At least this urgency gave us, this COVID gave us the urgency to trigger major changes. So thank you.
Absolutely.
Rosa is going to take over and.
Yes, thank you. Thank you everyone for joining us. We're really happy that we could reach the audience and that we had these two amazing panelists join us. If you want to stay up to date with our news and events at District 3, please join our newsletter. You can sign up at district3.co, and it's also not too late to register for the Digital Health Challenge with Cooperathon that Alexis is spearheading, and you can do so at cooperathon.ca. Again, thank you to Jutta and Alexis for joining us and giving us your insights. And VA, thank you as always for moderating and bringing this discussion together. So thanks to everyone, and have a wonderful rest of your day.
Thank you.
Yeah. Take care.